This video is for healthcare leaders who are responsible for creating a safe and respectful workplace for patients, their families, and staff through a workplace violence prevention program. We will focus specifically on the training and education requirements for such a program. You will learn the healthcare organization accreditation requirements, the federal and state requirements that govern workplace violence prevention, and the 6 key attributes of an effective workplace violence prevention training and education program. We will highlight the critical elements for success that every healthcare organization must implement. Implementing a comprehensive workplace violence prevention training and education program for your entire healthcare staff may seem daunting. However, stay with us and you'll discover it's more manageable than you might think.
Let's begin by understanding the accreditation requirements. All major accrediting bodies prioritize workplace safety, but the Joint Commission stands out with the most detailed requirements. While all healthcare accreditors provide a framework of requirements, they leave it to individual organizations to determine their own policies, procedures, and practices, rather than prescribing specific action steps. This approach allows for flexibility, ensuring each organization's workplace violence prevention program is perfectly suited to its specific needs and circumstances.
The Joint Commission is no exception to this approach. For example, here is the exact verbiage of EP 17 from their workplace violence prevention standards relative to the training and education requirements. And here is the exact verbiage of EP 29. This standard states who needs to be trained, when they need to be trained, and on which topics they need to be trained, but then leaves it up to the organization to decide what training each staff person will receive based on their respective roles and responsibilities. EP 29 goes on to explain the rationale for this standard, emphasizing the need for training on what constitutes workplace violence, the techniques to address workplace violence, and how to report incidents of workplace violence.
Now let's explore the federal and state legal requirements that govern workplace violence prevention training and education in healthcare settings. At the federal level, the Occupational Safety and Health Administration is the primary agency responsible for ensuring workplace safety, including the prevention of workplace violence. Although OSHA does not have a specific standard dedicated to workplace violence, it provides essential guidelines under the General Duty Clause of the Occupational Safety and Health Act. This clause requires employers to maintain a workplace that is free from recognized hazards likely to cause death or serious harm. Recognizing that healthcare workers are particularly vulnerable to workplace violence, OSHA has issued targeted guidelines for healthcare organizations. These guidelines strongly encourage the development of comprehensive workplace violence prevention programs that include thorough training and education for all staff members. At the state level, workplace violence prevention laws vary widely. Some states have taken a proactive approach by enacting specific legislation that mandates workplace violence prevention programs in healthcare settings. For instance, California's Workplace Violence Prevention in Healthcare Law, Cal OSHA Section 3342, requires healthcare facilities to implement a detailed workplace violence prevention plan that includes mandatory training and education. Other states are recognizing the importance of such measures and have adopted or are in the process of adopting similar laws. As this trend continues, it's crucial for healthcare organizations to stay informed about the legal requirements in their respective states.
The accreditation and legal requirements regarding workplace violence prevention in healthcare settings are being driven by the increasing incidence of violence-related worker injuries. It is widely reported that healthcare workers are 5 times more likely to experience workplace violence than other workers. However, the Joint Commission states that workplace violence is underreported, indicating that the actual rates may be much higher.
Now let's discuss the 6 key attributes of an effective workplace violence prevention training and education program. First and foremost, the program must meet the workplace safety accreditation and legal requirements relevant to your organization. It's crucial to select or develop a program specifically designed to comply with these healthcare-specific standards. Avoid using generic programs that claim to be suitable for any industry, even if they have a healthcare label added to their title. The healthcare industry is unique in many critical ways, and these nuances require a tailored approach. Therefore, your workplace violence prevention training and education program must address the unique challenges and risks present in healthcare environments. A targeted, industry-specific program will ensure that your staff is well prepared to handle the complexities of workplace violence in a healthcare setting, and that your organization fully meets the accreditation and legal requirements.
Second, the program must place a strong emphasis on conflict prevention. At Vistalar, we refer to this as non-escalation, and we highlight its importance through our 6 C's of conflict management framework.
The 6 C's of conflict management is a framework to analyze interactions and determine which conflict management method to use given the circumstances. The blue boxes describe the elements of all interactions. The red boxes describe what can happen when interactions escalate. Identifying the phase of an interaction guides the selection of what action to take to best manage the situation. Context: period prior to engagement. Contact: when an interaction begins. Closure: when an interaction ends. The primary goals of these elements are non-escalation, achieving the best possible outcome, and establishing a positive foundation for future interactions.
The third attribute of an effective workplace violence prevention training and education program is that it addresses the entire spectrum of human conflict. Here, conflict is defined as the escalation of human interactions that could lead to emotional or physical harm. Note that disagreement is not included in this definition. Disagreement is necessary and healthy for a well-functioning organization. Additionally, well-managed conflict can have positive outcomes, such as innovation and the development of new skills, so this type of conflict should not be diminished. Instead, a workplace violence program must focus on conflict that can lead to emotional or physical harm. Such conflict can manifest in various forms, as defined by the Centers for Disease Control and Prevention. Client-on-worker violence, worker-on-worker violence, criminal intent violence, and personal relationship violence. An effective workplace violence prevention training and education program must address all 4 types of violence. Furthermore, it should cover both verbal and physical violence. This point is emphasized through an expanded explanation of Vistalar's 6 C's of conflict management framework.
Conflict: when an interaction includes refusals or resistance. Crisis: when experiences exceed a person's coping skills. Critical: when behaviors are causing or likely to cause physical harm. All interactions progress from the beginning to the middle and on to the end. All interactions have a context, contact, and closure element, but only some interactions progress to conflict, crisis, or critical. The 3 red boxes should not be viewed as a progression. An interaction can escalate directly to conflict, crisis, or critical. The goal of almost all interactions is to remain in the blue zone and to enter the red zone only if others take us there. When that happens, the goal is to move the interaction to the blue zone as quickly as possible. There are times when it's necessary to proactively move from the blue zone to the conflict box to address a performance or behavioral issue. In doing this, you risk having to deal with defensiveness or aggression. However, if not done, adverse outcomes can result, such as unresolved conflict, reinforcement of bad behavior, and even conflict escalation. The 6 C's of conflict management, a framework for successfully managing conflict.
In other words, there should be no gaps in the training program. The entire spectrum of human conflict, from simple verbal disputes to physical violence, must be comprehensively covered.
So far, we have discussed 3 attributes of an effective workplace violence prevention training and education program. Meets the workplace safety accreditation and legal requirements relevant to your organization. Places a strong emphasis on conflict prevention, also known as non-escalation, and addresses the entire spectrum of human conflict. The fourth essential attribute is that the training and education program must enable different people within the organization to receive training based on their risk level. In other words, the program should not consist of just one primary training class for everyone. Instead, it should support targeted training that matches the risk level associated with each role. For example, low-risk workers might only require training in non-escalation and de-escalation. In contrast, high-risk workers such as security professionals will likely need more comprehensive training that includes how to physically intervene in a violent incident. At Vistalar, we call this a risk tier approach to training, which aligns with the Joint Commission's standard that organizations must determine what aspects of training are appropriate for individuals based on their roles and responsibilities. In our experience, healthcare organizations generally have 5 distinct risk tiers. The first tier includes staff members with no or minimal patient contact. The second tier includes patient care providers. The third tier includes higher-risk patient care providers, such as those working in emergency departments or behavioral health. The fourth tier includes crisis response team members. And finally, the fifth tier consists of security professionals. An effective workplace violence prevention training and education program must have classes tailored for each of these risk tiers to address the specific needs of each staff member and meet the relevant healthcare accreditation requirements.
Given that a workplace violence prevention training and education program must address the entire spectrum of human conflict and enable a risk tier approach to training, the fifth essential attribute is that all curricula must share common principles, methods, and terminology with a strong emphasis on universal application and simplicity. In other words, what is taught must be easy to learn, remember, apply, and teach. What you don't want are individual training classes that exist in isolation from one another. Instead, the training for each risk tier should build upon the previous tier, creating a cohesive learning experience. At Vistalar, we call this interconnected training approach the Unified Conflict Management System, which includes a systemized structure of methods represented by these framework graphics. All of these training programs share common principles, methods, and terminology to ensure consistency and alignment across all levels of training.
The sixth essential attribute of a workplace violence prevention training and education program is tailorable courseware. The courseware for each risk tier shouldn't feel like a generic cookie-cutter program developed by a third party. Instead, regardless of who developed the training, the organization must view the program as their own. This attribute is particularly important in California, where the workplace violence prevention and healthcare law actually requires organizations to actively involve employees in developing training curricula and training materials, participating in training sessions, and reviewing and revising the training program. Check out what Bob Durand at Kaiser Permanente says about this provision of the law.
One of the key attributes of California's workplace violence law for healthcare workers is that healthcare workers have to be part of the development process. If I purchase a third-party vendor product and I just give that to my healthcare workers and say, this is our training program, I've removed that step. In fact, I am non-compliant with the California law that says that workers have to be involved in the development of it. By taking a product, in this case with Vistalar with their licensing agreement, we're going to come together with our staff, we're going to ask them what they would like included, improved, added to, or removed, so they have a say in what the end product is. That's going to do 2 things for us. One is it's going to help us be compliant with the law, but more importantly, it's going to help us meet the exact needs of our workers, because our workers are going to be telling us what their needs are.
For an organization to truly view a training program as its own, the courseware must be branded with the organization's logo and colors and include organization-specific content, such as the organization's mission, values, policies, and established training elements. Additionally, any training provided as an online, on-demand course should be integrated into the organization's learning management system and accessed from there, rather than requiring employees to log in to a third-party system. Finally, the training and education program, if supplied by a third-party vendor, should not have these restrictions, prohibiting deviations from the vendor's defined lesson plan, requiring the purchase of vendor-supplied courseware in its cookie-cutter form for each student within the organization, restricting the incorporation of training content into other training modalities, such as virtual classes of different lengths or online on-demand courses, or limiting the development of organizational instructors to those trained by the vendor with mandatory periodic recertification. The end goal of this customizable courseware attribute is for the training and education program to meet the specific needs of the organization rather than seeming like an off-the-shelf solution.
In summary, an effective workplace violence prevention training and education program must meet accreditation and legal requirements, emphasize conflict prevention, address the entire spectrum of human conflict, enable a risk-tier approach, share common principles, methods, and terminology across all curricula, and offer tailorable courseware that aligns with your organization's unique needs. By focusing on these 6 essential attributes, you can create a safer, more cohesive work environment where your team is well prepared to prevent and manage workplace violence.
This video was developed by Vistalar, a conflict management training institute focused on building safe and respectful workplaces. Vistalar has over 4 decades of real-world experience in workplace violence and has published 6 books on conflict management. Our goal is for our customers to achieve these benefits from working with us: increase safety for patients, families, and staff, enhance patient satisfaction and outcomes, decrease injuries and workers' compensation claims, minimize liability and reputational risks, reduced absenteeism, poor morale and turnover, and enriched collaborative culture. On December 11, 2024, the Minnesota Hospital Association sponsored a 1-day seminar titled Safe Workplaces: Strategies for Violence Prevention in Healthcare. A Vistalar client delivered one of the presentations in which they shared the outcomes of working with Vistalar during the previous 2 years. These outcomes included a reduction in behavioral restraint use, seclusion incidences, and workers' compensation-related costs and injuries associated with workplace violence. To access a video recording of this presentation titled A Preventative Approach to Workplace Conflict Management, a case study, visit vistalar.com/fairview. To learn more about Vistalar, visit vistalar.com/healthcare.